Baclofen is a centrally acting muscle relaxant. It can be given to treat spasticity that is associated with multiple sclerosis. Multiple sclerosis is a condition where few neurons are damaged due to immune attack. It is common in young to middle-aged adults. Spasticity is one of the common symptoms of multiple sclerosis. In this condition, people may feel stiffness of the muscles. They may feel heaviness in the muscles and difficulty in the movement. They can also experience tightness and pain during the movements. Muscle spasticity involves the flexor spasms. These are the involuntary muscle contractions that lead to bending of the limbs towards the body. Particularly, they may include arms and legs. Spasticity also involves muscle rigidity and clonus movements. Clonus involves the rhythmic and involuntary muscle contractions and relaxations that may be associated with any neuronal injury in the brain or spinal cord. Baclofen can also be given to control the spasticity in the people with spinal cord injuries or spinal cord disorders. It can also be used for other conditions like the treatment of dystonias. Dystonia involves the involuntary muscle contractions due to a neurological disorder. It may affect various muscles in the neck, face, jaw, eyes, and limbs. Baclofen is useful for the treatment of spasticity associated with cerebral palsy and trigeminal neuralgia. In all these conditions, Baclofen can be used. Where it is not suitable, Baclofen is not indicated for treating muscle spasms that are related to rheumatoid disease. As this medication works centrally on reducing neuronal activity, it mainly relieves muscle spasticity that is related to neuronal disorders in the brain and spinal cord. Baclofen is also not indicated for people with stroke. In such people, Baclofen is not well tolerated. It may significantly affect the CNS and may further complicate the symptoms of stroke. Even Baclofen should be carefully used in people with seizure disorders, as this medication can increase the risk of convulsions in the people. Effect on renal impairment. Baclofen is mainly eliminated from the body through the renal system. It is excreted unchanged. Therefore, in people with renal impairment, Baclofen may be accumulated in the body, leading to its toxic effects. That's why, based on the severity of renal impairment, the dose of Baclofen should be reduced. Baclofen may cause urinary retention. It also increases the urinary frequency with incomplete emptying of the bladder. So in the people with any urinary obstruction, this drug may further increase the urinary retention. Therefore, in such people, Baclofen should be carefully given. Withdrawal effects. This medication should not be suddenly withdrawn because it may produce a few of the reactions like hallucinations, seizures, high fever, muscle rigidity, altered mental state, and even rebound spasticity. That's why the dose of the medication should be gradually reduced in order to avoid withdrawal effects. When it is given to the pregnant woman, a sudden withdrawal may result in the neonatal withdrawal symptoms. Therefore, the dose should be gradually reduced and finally it should be discontinued before the delivery to avoid neonatal withdrawal symptoms. GI motility. Baclofen should be carefully used in people with decreased gastrointestinal motility. As the GI motility is going to be reduced, this drug is not cleared from the body. It may lead to an enhanced absorption into the body, leading to its toxic effects. In people with peptic ulcers or gastrointestinal obstructive disorders, again, this drug should be carefully given. Central depression. Baclofen can produce central nervous depression. Therefore, it can produce some sedation, dizziness, and drowsiness. That's why caution should be taken while operating the automobiles or working with dangerous machinery, as it may impair attention in the people. The depressive effects may be more enhanced by intake of alcohol. Use of other CNS depressants like opioids, sedatives, and antipsychotics may further increase the drowsiness and sedation. Baclofen may also increase psychotic symptoms. It can induce hallucinations in the people. It may also develop a state of confusion. It may increase the risk of schizophrenia in the people with any risk factors. Therefore, in people with any previous history of psychotic disorders, this drug should be carefully given. How is it given? Baclofen is available as tablet, oral suspension, and oral granules. It is also available as solution for injection by intrathecal route. The onset of action of baclofen is 6 to 8 hours. A high-fat meal can reduce the absorption of baclofen. For the treatment of spasticity, baclofen may be given by oral route. Initially, it is given at a dose of 5 mg 3 times daily. After 3 days of the treatment, the dose may be gradually increased by 5 mg for each dose. It can be increased to a dose of 20 mg given 3 times daily. However, the total dose should not be exceed 80 mg per day. Baclofen can be taken either with or without water. In order to avoid gastrointestinal discomfort, it is preferred to be taken with food. Oral granules can be mixed with soft food for administration within 2 hours. Now let's see how it works. Baclofen acts by reducing the activity of a few neurons in the brain. It inhibits both monosynaptic and polysynaptic reflexes at the spinal level. That means it can inhibit the synaptic transmission formed by 2 neurons as well as that formed by multiple neurons. Baclofen reduces the release of excitatory neurotransmitters like glutamate. This reduces the neuronal activity and muscle contractions. Baclofen is a structural analog of one of the neurotransmitters, GABA, gamma-aminobutyric acid. Because of structural similarity, it can act on the GABA-B receptors, thereby it produces inhibitory response. On the presynaptic neurons, it prevents the opening of calcium channels. This leads to the inhibition of exocytosis and prevents the release of neurotransmitters like glutamate. On the postsynaptic neurons, it activates the GABA-B receptors that open potassium channels, leading to hyperpolarization. This prevents the excitation of postsynaptic neurons. By all these actions, baclofen can reduce the neuronal excitation and it can reduce the muscle spasticity. Now let us see the side effects of this medication. The important side effect of baclofen is on the central nervous system. It can produce some drowsiness, dizziness, confusion, and weakness. It can also increase the sleepiness in the people. Baclofen can also produce hallucinations. Few people may experience buzzing noise in the ears, slurred speech, tremor, and blurred vision. Other side effects like hypotension, insomnia, headache, constipation, and increased urinary frequency can also be observed. In a few people, it also produces some sexual dysfunction, particularly leading to loss of libido and abnormal ejaculation. So these are the various facts about this medication baclofen, which is a centrally acting muscle relaxant. This is particularly used in the treatment of spasticity that is linked with multiple sclerosis. It can also be used in the people with any spinal cord injuries or spinal cord diseases that leads to development of muscle spasticity. Baclofen is a GABA analog and it can act on the GABA-B receptors, resulting in the increased inhibitory response. This medication can increase the psychotic symptoms and it can produce urinary retention. In people with renal impairment, this drug should be given at a lower dose. Dizziness, sedation, and drowsiness are the important side effects produced by this medication, which may be enhanced when it is combined with other CNS depressants. It can be started initially at a dose of 5 mg by oral route, given 3 times daily. However, the target dose is 20 mg given 3 times daily. So that's all about this medication, Baclofen. I hope this video is useful to you. If you really like this video, please subscribe to our channel and share this video with your friends. Post your comments in the comment box. And please hit the like button to support our work. Thanks for watching. See you in the next video.